This 10th and final lecture covers BCIA Didactic Area 7, Adjunctive Interventions, and Area 8, Professional Conduct. This is from the BCIA Blueprint of Knowledge for General Biofeedback. First, let's start with intake procedures. The primary intake assessment tool of the psychophysiologist is the Psychophysiological Stress Profile Test, sometimes referred to as the PSP. As part of your discipline's professional training, you should learn how to conduct an initial intake interview. Typically, this involves gathering information about the client's principal complaint. No matter what type of biofeedback you're doing, always get a medical history so you are aware of any possible complications in the use of biofeedback. Biofeedback is often placed under relaxation therapies. While it is true that the monitoring of biofeedback signals will tell us if someone is relaxed, the greater power of biofeedback lies in the fact that the initiation of the relaxation response, or a shift towards parasympathetic functioning, can be operantly conditioned. That is, we can train people to have volitional control of autonomic or automatic functions. As with any shaping of a learned behavior, the behavior must be elicited to be learned, and this is where relaxation techniques are vital. Ideally, once a person develops operant control of the relaxation response, certain self-commands or cue words should elicit the response. So we will use various relaxation techniques to elicit the response that will be operantly conditioned. One type of relaxation training is called PMR, developed by Edmund Jacobson. PMR, or Progressive Muscle Relaxation, is a systematic technique for achieving a deep state of relaxation. It was developed by Dr. Edmund Jacobson more than 50 years ago. Dr. Jacobson discovered that a muscle could be relaxed by first tensing it for a few seconds and then releasing that tension. Tensing and releasing various muscle groups throughout the body produced a deep state of relaxation, which Dr. Jacobson found capable of relieving a variety of conditions, from high blood pressure to ulcerative colitis. He also found that deep states of physical relaxation were incompatible with mental anxiety. This led Joseph Wolpe to develop systematic desensitization techniques many years later. Autogenic training is a term for a relaxation technique developed by the German psychiatrist Johannes Schultz in 1932. It usually involves a series of sessions in which the patient learns to relax their limbs, heart, and breathing. The goal is to induce a pleasant, warm feeling throughout most of the body, but induce a feeling of coolness in the forehead. The technique is used against stress-induced. Autogenic training was used to combat stress-induced psychosomatic disorders. Other relaxation methods that can be incorporated into biofeedback training are guided imagery, hypnosis, and meditation. As you will recall, Herbert Benson studied his patients who practiced transcendental meditation when he discovered the positive effects it had on their cardiovascular health. Dr. Patricia Carrington was the developer of an alternative to TM meditation called CSM, or Clinically Standardized Meditation, which is a dogma-free method of meditation. The quieting response is a method of stress management that uses breathing and positive thinking, all in a 6-second technique that can be repeated as necessary. When we learned about the stress response previously, we learned that cognitive appraisals of threat can activate the sympathetic fight or flight response. How we perceive a stimulus as a neutral or interesting stimulus versus a threatening stimulus has a lot to do with our prior experiences, what I call our pattern recognition schema, and our prior programming. For one person, talking in front of a large audience may be perceived as a fun activity or a fearful one. Cognitive behavioral interventions like rational emotive therapy, stress inoculation training, and cognitive behavioral therapy address these cognitive distortions. We'll be finishing up this lecture series with a look at professional conduct. As clinicians, we should strive to be responsible and competent providers. Both ethical and legal issues are involved. Ethically, a professional provider must develop competence in the field of biofeedback through continuous education and training. Legally, there are limitations on who can provide services for the treatment of mental and physical disorders. Nash and his colleagues contend that biofeedback therapists who are not licensed mental health professionals should not be treating patients for a mental health condition unless they are working under the supervision of someone licensed in the field of mental health. This same argument can extend to physical disorders and their treatment using biofeedback. Biofeedback practitioners should become knowledgeable of both the legal laws and ethical guidelines in our profession. Both the AAPB and BCIA websites are good resources in this endeavor. Every profession has their own code of ethics. For example, the American Psychological Association lists the ethical principles for psychologists and codes of conduct on their website. It's important to remember that the clients we serve have rights as well. Privacy refers to persons and their interest in controlling access of others to themselves. Confidentiality is about data, not people, and about agreements and procedures for limiting the access of others to data. In judicial proceedings, a patient or client may refuse to disclose or prevent the disclosure of confidential information communicated to a healthcare professional. An informed consent must be obtained if disclosures are permitted by the patient or client. BCIA recognizes the difference between supervision and consultation. Mentoring falls under the category of consultation. You should make sure you read the Ethical Principles of Biofeedback, which can be obtained on the BCIA website, www.bcia.org, as well as the guidelines and policies for mentoring on the same website. We've completed the end of the didactic requirements for BCIA's certification in general biofeedback. Completion of this course, which includes passing the lecture quizzes, meets the requirements for BCIA Blueprint of Knowledge in general biofeedback. Congratulations on the completion of this course. Please contact us if we can help you in any way in furthering your education in the exciting field of psychophysiology and biofeedback.